My name is Dr. Steve Shoshani. I'm a chiropractor in Manhattan. I specialize in a technique called spinal decompression. It's a non-surgical technique that treats herniated discs, sciatica, spinal stenosis, bulging discs. It's an alternative to surgery, and we're seeing some fantastic results.
I had pain every single day, and I couldn't turn my head that much, and it was just debilitating. It was really painful.
Well, my back pain started during my pregnancy. And I noticed that it was getting increasingly worse. And right after I gave birth, I just couldn't take the pain anymore. So at that point, I started taking about 600 milligrams of ibuprofen. That wasn't working either.
I tried to look for different treatment options. I went to different surgeons. They all suggested I get surgery, and that would be the only real remedy for me to get better. They suggested other alternatives like cortisone shots and things like that. However, they weren't very confident that that would help.
A herniated disc is a condition of the disc. The disc is a jelly-type material that's between the two bones in your spine. What happens is there's a middle, we call it the nucleus, and an outer band called the annulus. What happens is as we age, the outer band, or the annulus, which is a collagen-based tissue, begins to break down. The nucleus, which is the middle, migrates outside and puts pressure on the spinal nerve, causing either pain or dysfunction. Spinal decompression, what it does is it does two things. It increases the height between the vertebrae, allowing the disc to create a negative pressure within a disc, which will then draw back the disc material, and it also increases blood flow to the disc, which will then allow the outer layer, or the annular bands, to start laying down new cartilage fibers so the disc can actually be contained and containing the disc lesion without surgery. Well, traditional treatments have always been focused around alleviating pain for the patients, whether they're giving them Vicodin or Percocet or Demerol, even in some severe cases. It's focused on getting rid of the pain, not necessarily addressing the reason the pain is there to begin with. With spinal decompression, we're going after the cause of the pain, which is addressing the disc herniation, which is putting direct pressure on the spinal nerve. So we're going directly at the problem, at which they will see symptom relief relatively early on in the program, but we're actually trying to correct the disc herniation, not just give them pain relief. The beauty behind spinal decompression is allowing the blood to return back to the disc. That disc will then start healing once again. Blood is very essential to this whole process, increasing blood flow to the disc to allow the natural healing process to occur. A lot of our patients do have weakness in their abdominal muscles or weakness in their back or really shortening hamstrings. So these are things that we incorporate into the whole spinal decompression program. We're teaching patients how to sit, how to stand, how to work, and more importantly, how to prevent this injury from ever coming back. Typically, when somebody comes to the office, we like for them to have recent MRIs. Most people that come to a spinal decompression specialist generally have already been to the medical doctor or have been to a pain management specialist or physical therapist or even consulted with an orthopedic surgeon about a surgery. So these people already have all the necessary diagnostic tests that we need to determine whether or not they are a candidate for the spinal decompression procedure.
Well, I went for my treatments. It was about 30 minutes a day, about 3 to 4 times a week. And on the 7th visit, I noticed that everything was changing, that I could finally get up in the morning and go for the run and pick up my kids without even worrying and walk up 3 flights of stairs to drop them off at school.
You know, right afterwards, I did feel significantly better at the time. I was able to walk more normally, and I wasn't relying on pain medication, and I felt like I was able to resume my normal activities. I think Dr. Shoshani is very, he takes everybody's on a case-by-case basis, which I like.
I highly recommend Dr. Shoshani, and I want to impress upon people that this really works. And don't hesitate, give him a call. He's so caring and capable And it's just made a tremendous difference in my life, and that I hope that this message helps someone out there.
If you're suffering from chronic or severe low back pain, or you have a herniated disc, or you've been told that you need a spinal surgery, please give me a call. I'd be happy to give you a second opinion and see if spinal decompression can solve your problems.